Yell, and I'm honored to have with me Mike English, who's the Executive Director of Turn the Page KC. All right, guys, everybody in person. With us today, we're on each side of the state, one in Kansas City, one in St. Louis, and Craig, we're gonna meet you in the middle somewhere. I think our goal was to meet you all in Jeff City, which has been our state capital and where a lot of the important work needs to be done. But today we're going to be really talking about an incredible opportunity here in Missouri to supporting federal child care. Our mission as a chapter of the National Campaign for Grade Level Reading, Turn the Page KC and Turn the Page STL, mission and vision is to improve third grade reading proficiency. What is the primary factor that will help improve third grade reading proficiency is making sure our children are kindergarten ready and have high quality childcare. It is extraordinarily extraordinary factor. Sorry, I'm admitting people and talking at the same time. So I'm going to go to the next slide. So why are we meeting this week? This week is the Grade Level Reading Week 2020, July 13th to the 17th. About 6 months ago, we all were excited to meet in Washington, D.C. over this week, and now it is virtual. It's exciting because these are the programs, and we will send this out to you, or Mike can put it in the chat room, how you can sign up for these national campaign for grade level reading seminars this week. The one that was just added, you guys can read through this, is on Friday, July 17th at 2 p.m. Eastern Time, which is 3 p.m. here in, I'm sorry, it's 1 p.m. in Missouri. COVID-19 in education, ensuring equity as we address COVID-19 learning loss. This looks like a phenomenal seminar to watch. Sorry. And what is unique about this virtual conference is that the Campaign for Grade Level Reading invited all states to also participate. So almost 20 different states across the country are supplementing the Grade Level Reading virtual week. And because of our two strongholds in Kansas City and here in St. Louis, we have an exciting conference schedule. Last week, we talked about school attendance in uncertain times. If you would like to have a copy of that webinar, and just put something in the chat box. Today, we're excited to present supporting federal child care relief, which is, it's going to be a very positive experience today. I think we're hoping to get some big money here in the state of Missouri from the federal government. Join us this afternoon for After School in Uncertain Times with Ellen Bellini and what her program Campfire is doing during these times. And then a really exciting program tomorrow at 10 o'clock is about the science of reading and K-3 teacher professional development. Yesterday we talked with the head of education for the Department of Education in the state of Mississippi, and one of her colleagues, Dr. Antonio Fierro, is going to join us to get into more detail. So just a few housekeeping details. At this point, please welcome, and please say hi in the chat box now that we've got some people here. Tell us where you're from. Also, this Zoom meeting will be recorded and a copy will be available along with the slide deck for you after our meeting today. You are muted throughout the presentation, but feel free to ask questions in the Q&A box during the presentation. After the presentation, you can unmute yourself and ask questions. We'll see how that goes. It could be fun. And enjoy and be inspired. We are here because our kids, it's all about the kids that we serve in our community. Kids Win Missouri, support for federal child care relief. That is our meeting today. Our presenters are Brian Schmidt, who's the Executive Director, Craig Stevenson, who's the Director of Policy and Advocacy, and Casey Hansen, who's the Director of Outreach and Engagement. I welcome all three of you today. Thank you for joining us. Kids Win Missouri is a coalition dedicated to advancing the health, education, safety, and development of children and their families. The organization promotes evidence-based policies that ensure children and families have access to high-quality, affordable early childhood education opportunities, health insurance coverage, and quality health care, basic needs like food, shelter, and economic supports, and quality education, college, and workforce preparation, and wraparound services. So with that, I would like to introduce you to Brian Schmidt, the Executive Director of Kids Win Missouri.
Great. Well, thanks so much, Lisa. And thanks so much. Appreciate the opportunity to join with everyone this morning. And I just wanted to kind of provide a little bit of context for kind of how we got to where we are. So Kids Win Missouri as an organization, we've been working to gather feedback from early childhood stakeholders from across the state. And we are planning to do a lot of outreach starting in February and going through May, and then the pandemic hit. And so a lot of our meetings that we had scheduled had to get reformatted. And originally we were really focused on like more long-term system and policy goals. But yeah, I think, once the pandemic started, we really, it was necessary to shift our focus to the more immediate needs of child care providers. And so I'm going to introduce Craig Stevenson. He's our Director of Policy and Advocacy at Kids Win Missouri. So he works, he's based out of just north of Columbia, but he's in the Capitol nearly every day during the state legislative session, which runs January through May, and really kind of tracks policy both at the legislative and the administrative level for Kids Win Missouri, and also hosts weekly calls with that's available to the general public each week during the legislative session. But I'm going to turn it over to Craig to ask him to see if he can provide just some context for some previous federal support that was provided to child care.
Yeah, thanks, Brian, and good morning, everyone. Thanks for being here again. Just for some context, is we obviously know the pandemic, really started to take off in early March, and by late March, the federal government, Congress acted with the CARES Act, as you all know, and was signed into law in, I think it was March 27th. The CARES Act included about $3.5 billion for the Child Care Development Block Grant. And so that's the mechanism for the Child Care Subsidy Program. And so that money was intended to really be flexible spending for states to react and support child care providers and families during the pandemic. And so each state created their own plan of how they would spend their money. And I think it's important for contextual sake, $3.5 billion in a one-time shot is just more than half of what the typical annual appropriation or annual amount that states get. So Missouri gets about $150 million a year for the for this program. This provided $66 million for Missouri in a one-time shot in the arm. And the state then, about a month after it passed, released their plan of how they were going to spend the $66 million. And the state created a plan that would do a couple of different things. It would focus specifically on helping childcare providers and then helping families. And so, for example, for childcare providers, it did a couple of different things, including if providers remained open, they were eligible for a one-time stipend. It changed the way the payment structure for those children on the child care subsidy program were from April through June. And that's a couple of examples. And then for families, what the state decided to do with this money is expand the eligibility for who was eligible for the subsidy program, knowing that so many people were all of a sudden unemployed and needed this assistance. And so they created a plan. I think what's important to kind of note, and why later on we're going to talk about a call to action and why this is so important. We're coming up on a really critical time for a couple of different reasons. Well, the first reason being the support that was given to childcare providers in a direct way ended as of June 30th. And so the state is articulating that until they have a better sense of if the other things that they budgeted were on target, there are no more funds to help childcare providers. And so that's kind of the one piece that's really critical to know. And then the other component for families, the portions of the plan that benefit families is set to expire at the end of August. And so that's the other thing I think that is really important. So one is already expired. The other one is coming up very quickly as we enter now the second half of July. And so all of that sets things up, and I'll turn it over to Casey to talk about, as Brian introduced, we had planned on reaching out to childcare providers and having conversations about the needs, and COVID kind of flipped that on its head, and we transitioned that to really want to better understand what childcare providers are thinking, feeling, experiencing, all of those sorts of things. And so Casey, I'll turn it over to you.
Thanks so much, Craig. Again, I'm Casey Hansen. I'm the Director of Outreach and Engagement with Kids Win Missouri. And so a big part of my job is connecting with our members and stakeholders in the community to help better inform our policy work and the work that Craig is doing in the Capitol. So we worked, Lisa, go ahead and go to the next slide, if you will. We worked from April to June to really engage with child care providers from all different types of settings and all geographies around the state to better understand those challenges and the barriers to operating in the current environment. And, you know, when we were doing that, that was both when a majority of facilities were closed. Some were operating through the pandemic, and then some were in various stages of reopening throughout us having those conversations. Some of our key takeaways, and go ahead and go to the next slide, Lisa. I think, oh, nope, this is the background. I'm sorry, go back. So our key takeaways really, and I'll go through these in more detail, are just that this has caused a massive disruption to the child care industry. And as Craig alluded to, a lot of those funds that were emergency supports, whether that be PPP or the additional subsidy dollars from the state, those funds are out the door, and the current payment structure is just not set up in a way that helps programs either operate through this, the current challenges, or to think about reopening and scaling operations back up to where they were pre-pandemic levels. The impacts that are being experienced by programs are not equitable in any way, whether based on geography or the racial makeup of the families served or the providers themselves. This is just hitting providers in very different ways. And so, you know, that's a challenge in and of itself as we think about distributing resources and figuring out how to do that in a way that is meeting the needs of providers where they are. Quality is of great concern always, but particularly now, just as programs are navigating all of these new guidelines and regulations, how they can continue to provide quality care to kids. and how they can do that in different ways. And, also just acknowledging that the challenges of kids and families right now are so great that how providers can have the resources and training needed to adapt to that. And just the general takeaway that the childcare community is overwhelmed in this moment, whether it be from just having to implement all of these new guidelines with reduced income, reduced enrollment, figuring out how to scale back up and get their operations back to what they were used to pre-pandemic, but also acknowledging they have to operate in this new environment. And then the level of stress of providers themselves, of the teachers, of families and children. The needs are great, which is why our big call to action and what we'll talk about in more detail is just the $50 billion being needed to stabilize the childcare infrastructure so that we can really, help in the moment, but then also keep it in a good condition so we can continue to build on some of the momentum that we've made over the last several years in Missouri. So just a background, we had several, go ahead to the next slide. We had several sessions. We talked to over 100 providers, either through a survey or many of them in Zoom sessions like this one. And again, we tried to target a variety. So we had sessions that were regionally based and tried to hit all of the different regions of the state. We also put a lot of consideration into making sure we had a blend of early childhood and school age providers, subsidy providers, licensed providers, not licensed providers, and providers just in a different setting. So we really talked to a variety of people located across 19 counties, and then, their county, they serve more counties than that, and then across our congressional districts. So go ahead and keep going, Lisa. Again, these were the key takeaways that I just kind of went over. So we'll go through those in detail with what we talked about with the providers. And then the next slide, just to go into more detail with that $50 billion ask. We really think that we need funding that is quick. As Craig mentioned, the enhanced payments that providers were receiving ended as of June 30th. And so we have providers right now. We had a call last week with a provider who said she's having to have double the staff. She has 50% of the enrollment and she serves 99% subsidy kids. So, I mean, the numbers just don't add up for providers. We've also talked to, on the other end of the spectrum, school-based providers that are fee-based programs that typically don't rely on public assistance, but they've been closed down. They haven't been taking in income. And, in order to scale back up as we think about schools reopening and some of those challenges, there's a great amount of needs and they're very diverse, and we need flexible funding that can really fill the holes that providers are seeing through this pandemic. So we'll go into some of the details now. Lisa, go ahead and skip to the next slide. Reiterate some of what I talked about, some of those challenges that creating a stabilization fund could help providers fill. Sorry, go ahead to the next one. So some of the community conversations, we really focused on 4 main areas, and that was health and safety, business operations, program quality, and then communications. So these were kind of the areas that we had been just hearing a lot about in casual conversations. And so we tried to gear our conversations around these areas to better understand what those challenges were. So on the next slide, we'll start going through some of the health and safety pieces. There's a huge amount of guidelines, recommendations, regulations coming from both the CDC and the local and state health departments to help providers operate in a safe way. And so we talked a lot about the things that providers were having to do to implement those different procedures. There were a lot of new needed supplies and equipment, as well as new staffing needs to meet some of the group size regulations, some of the stable group or having the same staff with the same children, those regulations and guidelines. So providers were just struggling with all of that and figuring out how to implement things. And there were a lot of costs associated with a lot of that, obviously, whether that be the additional staffing or additional equipment, figuring out supply chain pieces, so how they could access that equipment when, you know, everyone was reopening at the same time in a variety of industries. So, you know, they're competing with everyone to get that PPP and other things, especially in some of our areas of the state that were severely impacted by COVID. So we also still heard, though, from even some of our small rural home-based providers that, you know, they had buying limits on milk or buying limits on the meat that they normally would serve in their childcare facilities. So some of those things really were what the providers were concerned about, it just in terms of meeting those health and safety guidelines. Providers expressed a lot of concern just about the workforce, whether it be the racial demographics of the workforce, and knowing that African Americans have been 4 times as much impacted by COVID in Missouri. The aging nature of some of the workforce, so knowing that there are folks with you know, in that risk category or with health conditions that put them at risk. And then knowing that it's a low paid workforce, many without access to health benefits. So just providers were very concerned about, you know, what the health implications were for the workforce. And then on top of that, the mental health piece of it, and just the stresses on providers and teachers having to deal with their, you know, personal situation through the pandemic, having to deal with childcare of their own, and implementing all of these new procedures and things. So those were the things we talked about that a lot of providers had things to say about in the health and safety space. Go ahead, Lisa. Business operations was another major one. And so we found that most providers had access to some kind of assistance to really help in the short term. So whether that be many of the private emergency grants around the state, the PPP and Small Business Administration loans, some of those enhanced subsidy payments and other things from the state and from the CARES Act. Providers had accessed those things that could fill the gaps in the short term for the most part. Many of them were just still concerned about long-term sustainability. So knowing what all of the added costs are, and knowing that, you know, their capacities were reduced, their enrollments are reduced, just trying to make sense of how that would work long-term is what most providers were and still are, I think, grappling with. And then, you know, I talked a little bit about already you know, some programs were in the space where they needed some injection of funds just to be able to scale back up. Some programs were in the space where they need some funds just to keep maintaining where they are now. So those kinds of concerns were a bit varied depending on the nature of the program, but all of our providers were thinking about those things. And then there were some costs just associated with if they tried to deliver services or care in a virtual way, or they might have gotten into food and basic necessity distribution or those types of things. And all of those new services had costs associated as well. And for many of them, it was a way that they could keep their staff engaged and employed and checking in on families. But some of them, you know, they ended up providing mobile hotspots or devices for their children and families, as well as their staff, to be able to do that virtual care. So those things are just, there's been a lot of business cost necessities, and then just some of the additional things that programs are trying to do to meet the needs of the moment. And then maintaining staffing levels is just has been a concern in the childcare space in Missouri for years. And, you know, now it's even more so, just recognizing this is an industry of parents, many of them having their own childcare issues at the moment, especially with schools being closed and not being able to, you know, find space for their own kids, the health and safety of staff, and them having, you know, closures or times that they had to be quarantined, and just there's not just a system in Missouri or in any of the regional areas that we talk to that for substitutes and those types of things. And so this is just a major concern, I think, for providers as well. So on the next slide, this is just a couple of the reflections from providers. So we had, you know, a home-based provider here talking about all of the additional work and getting the supplies they need just to maintain business in a somewhat normal way is a little bit challenging at this point in time. And then at the bottom, we have another example from a school-based provider. You know, typically their program is 100% parent funded and everything's rosy. They don't have additional state funds coming in, but they're in a challenging position now because they've tapped into all of their reserves and they need to scale back up. And so needing access to the funds to do that. Go ahead on the next one. All right, program quality, as I mentioned, was another thing that kept coming up. Providers just, you know, everything in this moment is about health and safety. We're in the middle of a pandemic, so it should be. But, you know, providers, whether they be early childhood or school age, talking about how they can still make their programs have quality educational and enrichment opportunities while also implementing all of those additional guidelines and things. And, you know, for many of them, just knowing that they weren't seeing their kiddos for several months and, you know, they might have been making progress on certain developmental things, but without, you know, having access to the kids or that peer connection in the classroom, just, you know, recognizing that there's going to be things that they need to address, possibly new needs or emerging needs or things from their kiddos and families that they need resources and training to be able to do. And it's hard for providers, I think, and they find themselves in a bind and, you know, focusing on both things at a highest priority. And then also where we have these financial issues, you know, programs have to direct those resources to the safety pieces. So, you know, people are becoming concerned that will quality suffer because of that? Will we not have the extra funding to do those additional quality supports? So, on the next slide. Communications was another big thing, and through this whole pandemic, you know, I think there's, you know, we've kind of been exposed to like some of the challenges around the different levels of government, and if there's, you know, not one order coming from whether it be the federal government or the state, and then all of the different local entities are interpreting things or making their own orders, it can cause a lot of confusion, especially in childcare when you know, folks just want to know what they need to do to operate safely for kids, and providers talked about being a little bit of overwhelmed with the amount of information coming in and then having to interpret between CDC guidelines or what came out of the state or what came out of their local authorities. Some of them talked about, you know, having really positive experiences and relationships with that local authority. They were very clear and giving a lot of information on what they needed to do, and, you know, others didn't. So that's another, you know, place where we kind of saw a little bit of disparity between the different regions in the state and depending on how involved their local department was. And then just in childcare in general, we know in Missouri, you know, there are a lot of state departments involved in childcare in different ways. And so, you know, a lot of providers talked about just the need to kind of coordinate that better and have a more consistent, clear message coming, you know, preferably from one source, so that providers weren't having to kind of, you know, juggle and interpret things themselves coming from the different agencies. So that's something that we've, you know, heard about in our sessions before the pandemic as well. And then, you know, as with many things, this is shining light on some of those problems in a different way. So go ahead and continue. We wanted to include just a little bit of a background of the different providers we talked to. We looked at race and age, especially just knowing the different impacts that COVID has on different groups. And so this was just kind of shows you, you know, we also, I should say our target was administrators and owners and directors. So, you know, some of that might naturally mean that it's an audience that skews a little bit older, but then if you go to the next slide, you also see that, oh yeah, most of the people that we talked to were in the field. We didn't have anyone that was in the field for less than 5 years that we talked to. So most of the people that we talked to were in the field for a very long time, which, you know, I think was very enlightening for us too, because they were able to talk about how things were for a really long time and then, connect that to now too. And then you can see we talked to a good mix of early childhood and school age and providers that do both. So I think, Brian, am I kicking it back to you for a minute to talk about where we are in more detail?
Yeah, let me, so we just we released this report, and thanks so much, Casey, I appreciate it. We released this report and you can find a copy of it if you go to that link. And I'll also put the link into the chat box. Let's see here. And then, but I just wanted to kind of circle back to Craig to kind of give everyone a sense of like where things are now, because a lot of what the folks that have the greatest capacity to provide relief is at the federal level. And so Congress has kind of been debating what may be included in a fourth relief package. And so I'm going to turn it back over to Craig to see if he can provide some details on that.
Yeah, thanks, Brian. I do think it's important to note that one of the things that so we've done this report and talked to these providers. What we heard is very consistent with other states, and which is really helpful because I think that sets up the case for congressional support in a really significant way. Specifically, the back in May, the House passed the HEROES Act, which was kind of their fourth package. And unfortunately, the Senate didn't do anything with it. That package had about $7 billion, so it doubled the CARES Act funding for for child care providers. But what's happened since May, because of the outreach of our providers, like in Missouri and across the country, we've actually seen new numbers and new discussion of the need for more than that $10 billion that was in the $7 billion that was in the HEROES Act back in May. So specifically, the child care community is requesting $50 billion, and there's a mathematical kind of reason for that, and I don't want to necessarily go into that unless there's questions. But so Senate Democrats have clung on to that number as a negotiating point, and I think that it's also really important to note that Senator Joni Ernst, who's a Republican from Iowa, has taken the lead and has put together a letter with I think it's 20 or 22 Republican senators who support investment in this new package that they're beginning to work on for $25 billion. So that shows the impact that folks are the congressional members and senators are hearing from providers and know that that childcare is critically important, and losing childcare providers is critically important. And so kind of where we're at now is that the next 3 weeks are really critical. And so let me kind of explain why. First, so the U.S. Senate is on recess this week, but the Senate leadership, Republican leadership, is crafting. The news has been reporting that they're crafting a bill, and as Brian indicated at the top end of our webinar, that details will be released next week, and so then that'll be the negotiating kind of starting point between the House, the Senate, and Senate Republicans and Senate Democrats. And so when next week, when that is released, the Senate will be in session for basically 2 weeks, and then they typically go off. August is not a time when their Congress is typically in. The congressional members and senators spend a lot of time in the state doing different things. And so the next 3 weeks are critical that they continue to hear from childcare providers and supporters of the childcare community. And so I think in the chat box, Brian and Mike have put some details of what we are asking. I think what's incredibly important and encouraging to see is, the things like Joni Ernst, stepping out and saying, hey, the House passed 7 billion. That's not enough. We need 25 billion. While Senate Democrats may think 50, the childcare community thinks 50. Kevin McCarthy, who's the current House Minority Leader, last week released an op-ed in the USA Today talking about how the fourth package had to include significant funding for the childcare and school-age community. And so what's really encouraging, while there's so much kind of tit for tat and infighting, if you will, of what is going to be in this next package, childcare is, I think, going to be a part of it. The question is, how big will the number be? And the more they continue to hear from providers and advocates, the better that will be. And so, Casey, I'll turn it over to you to share how folks can share that message.
Yep. So, I mean, our message really, and why we named the report Paving the Road to Recovery, is just that childcare is critical infrastructure for our state. In order for parents to work, in order for our economy to really function the way that we're used to, childcare is a big part of the equation. And that's why we need quick and substantial investment again. So that $50 billion number, there's, as Craig alluded, there's a couple of proposals out there, but the reason that we'll keep emphasizing that number is because we need that, as I talked about, for that wide variety of issues and challenges that providers are facing across contexts, and not just your typical subsidy providers, but all childcare programs. So we need that funding to be substantial. We need it to be very flexible to meet those different needs, whatever they might be. And we need it to be equitable so that it's really helping to ensure, especially in communities that are hard hit by COVID-19, that they're able to sustain childcare through this, because ultimately it's to serve kids and families. And so, that's why we need to continue pushing. And the couple of actions that have been put in the box, they're kind of reflected here as well. So the take action is that action alert that Brian posted. It's really a pre-filled email. You're allowed to customize it however you would like as well, but if you do that, it takes about 2 minutes. So that's one that you can do really quick. It'll also give you the option to share it on your social media. We encourage you to do that because anyone that's a parent or anyone that's a business owner or anyone that works in a program, many of us, even those of us with coworkers who have kids in childcare, I mean, this affects all of us and it affects our entire economy. And so we just want to encourage everyone to take that one action that literally takes 2 minutes of your time. Next, we also have on our Childcare Relief website, you'll find calling scripts. We're going to send out an email also later this or next week to do a call to action day, where we'll just be encouraging people to call our U.S. senators in particular, but you can also call your congressional office as well. And just, it's basically the same thing as the email, but just another way that we can reiterate that point and let them hear from constituents in Missouri that we need a quick and substantial investment in childcare in this next package. And then if you have a story, we also have an option to share your story. So if you are a child care provider or if you're a parent like me who relies on childcare, you can share your story at that link. And it can just be a quick video, and we'll be using some of those on social media over the next couple of weeks to kind of amplify that message again. And just anyway, if you aren't creative and don't want to come up with your own posts, I mean, just following Kids Win on Facebook or Twitter, Kids Win Missouri, you'll find us pretty easily. And just over the next couple of weeks, helping us amplify those messages because we think, this is so critical to kids and families in Missouri, both in the early childhood space and, as we are hearing more of this discussion around schools opening and partial reopening or full reopening, I think we have to consider also that childcare serves many school-age kids and parents as well. And, that's why, again, that substantial investment is needed because this affects so many in our state. So happy to ask or to answer rather any questions if anyone has any or it's helpful.
Yeah, so can I start out with the chat box questions? We got some that people sent to me privately here. And really, I think one for you, Casey, and then one for you, Craig. Had during your survey period, did you hear any concerns from childcare providers about the burden of serving school-age children in addition to younger kids when schools closed?
Yeah, that is something that came up, and I think in part in our quality conversations. Especially in some of the smaller, I think, home-based facilities, I heard a lot more about it, where they might just have one all mixed together group. And so if they weren't used to that, trying to figure out curriculum and things that are appropriate for a 2-year-old and an 8-year-old, and things that work in that setting. And some of the bigger facilities that, typically serve school age, and they were able to have school age kiddos in groups, with other school agers, I think not as big of an issue. But yeah, it's definitely something we've heard, as well as just staff having school age children. And the staff of those facilities, typically their kids would be in school, or they would be in summer camp, and if that's not the case, we heard a lot about that in centers either, not having space for those school age kiddos too, or just the staffing issues around how they can make that work when their staff don't have school age option. So those were some of the things that we heard, I think, that pertained specifically to school age.
Well, and then a related question, I think maybe this could be for you, Craig, is when schools do go back, at least in Kansas City and probably in St. Louis, there will be some that go back using a hybrid model where there are kids going to school maybe 2 days a week, and parents needing childcare for those other 3 days per week, and they will be distance learning on those 3 days. In addition to this funding, is there any either CARES Act funding or other K-12 funding that childcare providers could get access to in order to take care of and facilitate distance learning on those off days?
It's a great question, and something that we have seen, I think, work fairly well in the St. Louis area is that part of this, the significant influx that came into the state of CARES Act money, a large portion of that was dedicated to municipalities, to local governments for COVID-specific things, but and as time has gone on, those definitions of what and things of what could or couldn't be included in that have changed a little bit and broadened a little bit more. So I think there are opportunities. I think it was St. Louis County, right, Casey?
Mm-hmm.
Yeah, St. Louis County had dedicated, it was like $5 million that they set aside for childcare providers, strictly of CARES Act money that was sent to their municipality and impacted by COVID. Now, I think each county has the authority to make those decisions. And so one of the things that we would encourage folks to do, especially smaller counties, may have a hard time figuring out how to spend the resources. Childcare is actually a really good opportunity because they're a business that has been hit in a significant way. So I would encourage you to reach out for folks to reach out to their county leadership to look for, to even look at the St. Louis County model as a potential solution there. But outside of the CCDBG money and the CARES Act state plan and the county money, other than potential, PPP and other small business loan opportunities, those are the biggest areas where the federal government has tried to support the childcare provider.
And then one more question is about the supply chain for PPP equipment. And I've heard this too from local childcare programs that they simply can't find disinfectant wipes and other equipment that they need. Any tips on where to purchase some of this personal protective equipment that's so hard to find? Has anybody been hoarding it?
Yeah.
Childcare Aware, I know, is one place. And then I know St. Louis has kind of, through United for Children, set up like regional hubs. I haven't heard a lot about that through other places, but if you happen to be located in St. Louis, reach out to one of us and we could connect you.
I think United for Children is on this call too, in this meeting, Bridget. So I'm sure you can reach out to United for Children and they can help.
Yeah, I can put the link for the hubs in the chat so anybody has access to it if they're interested or needed. Thanks.
Bridget, didn't want to call you out, but thank you.
Yeah.
And I will maybe add that I think, I know that as more municipalities go to mandating masks for businesses, I know there will be a need, or it was brought to our attention, there likely will be a need for masks that have the clear, a clear space for children, especially young children, for that importance of the social emotional, being able to see reactions. And so if folks have sources, I know that's on Child Care Aware of Missouri's radar as well. But I know that in Columbia, we just implemented where employees have to wear the masks, and folks have been using Etsy and other places to find those resources, but recognizing the importance of them.
So we just got another question, and maybe this is for you, Craig, but why 50 billion? Why was that reached as the target number?
Yeah, there was a couple of economists with some of our national colleagues that did a calculation that said that if you look at the added cost of to the child care profession, whether it be that's not accounted for, so whether that be cleaning that has to take place, whether that has to be hiring of new staff to rotate if folks are test positive, or quite frankly, lower enrollment. And some providers are going to be able to charge their parents to hold their slot, and other parents are not going to be able to afford that, and childcare providers are going to not feel comfortable doing that. And so there's a large kind of mathematical equation that said that really actually says that the childcare profession across the country needs like $9.5 billion a month in support to try to, until the end of the pandemic, to try to get through it. And so the $50 billion number was calculated in that kind of sense of like, we need to continue, $3.5 billion was a down payment, if you will, towards that support. But I think what we have seen in Missouri, that if you look at how the funds have been spent, or reported to have been spent, the support for the child care providers was very quick to go and has been maxed out, their budget. The families utilizing the additional child care options through the state payment, probably for a variety of reasons, it isn't coming to fruition. And so all the more important, I think when you see that, all the more important to continue to invest in child care providers, making sure that as we come out of the pandemic, that we still have a child care supply for parents to utilize.
Great, thanks, Craig. And then Casey, I think you wanted to follow up on the school-age children question.
Yeah, one thing I just thought of when you were talking is some concern in the school-age community just about space being an issue. So as you kind of alluded to, with schools doing A days, B days, and spreading kids and teachers out more, many school-age programs rely on the space in schools, and so that's another area of great concern for many of our school-age programs that are either a school operating their own program or a community partner operating the program, but they're in a school, and so not having space. And so then where do all of those kids just go in general? So just another thing I wanted to bring up, because I think it is just another reason why school-age programs need that advocacy as well.
And then I'll just add to your point, the devices and Wi-Fi access are going to be hard too, because if you're a third grader and you are in a childcare program, during your off day, you're still expected to complete assignments through distance learning, and without Wi-Fi and a device at that program, you can't do it, and you just can't complete those assignments. So I've heard that from programs too, and actually some childcare providers, reaching out and looking for iPads and hotspots so that they can be ready.
Yeah, we heard some of that too, or just, the need, one provider just said she had no idea how many of her families did not have access to a laptop or an iPad in their house. I think sometimes we take for granted, but when you're thinking about actually delivering that virtual programming and realizing that need is great too.
Is there money in this CARES Act that would provide funding for broadband access that is lacking in our urban core along with our rural communities? Craig, I guess I'm asking.
Mm-hmm.
Yeah, I know that. So at the school district level, that is a reimbursable expense. So again, there's a large portion of funding kind of carved out in the CARES Act for education agencies, local school districts. What I don't know is like if and how childcare providers fit into that. So like I know that in my district and Columbia as well, I don't live in Columbia, but both of our districts, as many have provided devices and hotspots to kids and families who didn't have that. So that might be a possibility for reimbursement at the district level, but I don't think that the childcare provider, if you will, unless they're connected to a school district, would have access to that.
Yeah, and I hate to talk about this because I don't know the specifics, but I think the governor dedicated like separate state funds toward the broadband issue. I believe it was $20 million just to expand broadband in general in Missouri.
Not enough.
Yeah, not enough, but yeah. They said that the $20 million investment is supposed to connect 10,000 more households by November. So.
Is it all rural? Is it a rural initiative?
That I can't say I know for sure. I would assume, but I don't know.
The only thing I would maybe add as we begin to kind of wrap up is just to encourage folks to take action. Just one more kind of gentle reminder. We know from our conversations with Senator Blunt and Senator Hawley's office, Senator Blunt in particular is key. So basically the part of the bill that will be passed comes out of Senator Blunt's jurisdiction as chairman of the Appropriations Committee that he is chairman of. And so it's really important. And so he is personally engaged. We know that. And then as we've had conversations with other of our like congressional members, House members, one of the staff actually told me on the phone, he said, this wasn't on my radar until I saw on Facebook that my childcare provider has gone out of business permanently. And so, that shows that even like how critical it is to really make the outreach because the staff are paying attention. And I mean, if we're honest, childcare has not been on the front burner of Congress in a long, long time. So it's encouraging and discouraging, right? And discouraging that this is happening, but encouraging that there's positive conversation about investing in our kids and families and childcare. So.
It's encouraging. It's encouraging. Do we have any other questions?
That's it from the chat box.
Is the state of Missouri better prepared for the influx of money if it comes to be able to disperse it? I was, several childcare providers here in St. Louis were angry, maybe Casey knows a lot about this, that it took months, weeks for them to receive any support once COVID hit. I don't know the details, but I know the anger that was going on in the community.
Go ahead, Casey.
I don't know how to answer that other than to say, I mean, I think we know as an advocacy community and like from talking to providers what the needs are. And I think the department better understands that now. I mean, our state across the board has outdated systems and, you know, payment procedures, it would seem, from working on a lot of different programs. So, I mean, I don't know, I can't really speak to that, and maybe Craig or Brian will have something different, but I do feel like now, if we got the influx of money, I think we understand collectively more like what the immediate needs are. And so hopefully that will help. At least maybe there won't be as much time spent in like, how do we spend it? Hopefully some of that's been a little bit more clarified, I think.
Yeah, I think Casey's right. I think the only thing I would maybe add is that there's kind of a reality that if the funds come through as we assume the Child Care Development Block Grant, there's 12 staff members, and so there's 12 staff members who typically operate, a budget of 150 million in federal dollars, right? And so if all of a sudden they have an extra, say we get the 25 billion, right? Assume on the low side, and we get $500 million, that's 4 or 5 years worth of money at once. And so I think that it's fair to say they would be overwhelmed or would feel overwhelmed because their systems, as Casey said, are not designed for that, and their staff isn't designed for that. I think hopefully, just like all of the things, whether it be if there's an extension of the PPP loan program or all of the other mechanisms, going through the process once a couple of months ago will hopefully make it smoother. We know in our conversations with DSS that they've acknowledged some of the struggles that they had and lessons that they've learned. And so I would hope that it's a little bit better, but I think it's also important that if they get $250 million and say, here, spend it in the next 18 months, and that's what they typically spend over 2 years, it's so different. But I mean, I'm not trying to make excuses for them, but I think there's some reality there that does have to kind of be brought to light. Brian, you are in these conversations as well. Is there anything that we've missed with that question?
I don't think so. I mean, I do think that there are this first round, there at least is additional capacity to do that, or additional understanding of what additional capacity is needed to distribute funding. But I'll be honest, I don't know the ins and outs of their technology. I know that, pretty much all of state government works on outdated systems. It's just a struggle that we see not only in, the CCDBG program, but at the Department of Revenue and in Missouri's Medicaid system. And so it's just basically something that is almost like everyone has come to accept in terms of state government, that they work in outdated technology. I mean, I think one of our partners, Brian Colby from the Missouri Budget Project, said, we don't let two of the only programmers that know our systems fly on the same plane because, we don't, that's too much of a risk. And so I don't know if I have anything else to add, other than I think that at least we know that there's a greater understanding of what those challenges are right now, and hopefully that can serve as information that can help us through this next package.
I want to thank you, Brian, Casey, and Craig. Amazing information. And now the work begins for us on this call, and you're going to be getting information from Mike English and I about how you can take action today. It is a very timely. This is not something you can do in a month from now. You got to do it today, tomorrow at the latest, and forward to your community and your stakeholders. And let's get this passed in the Senate. And let's get some money here for this much needed childcare industry. And I want to thank you all for coming, and please know that you are welcome to email me or Mike anytime with questions, and have a wonderful Tuesday. And then we all do the wave, right? Even though we don't really wave when we leave meeting, like we don't really do this, but now we're doing this, right? Wave and all. So, all right, have a wonderful day.
Thanks,
Thank you.
Lisa.
Thank you, Lisa.
Bye.
Thank you,
Thank
Mike.
you.
Bye-bye.
Thank you.